There are 10,000 strokes per year in the UAE, of which only a very small number get the appropriate attention and treatment. A stroke is an acute onset, a sudden onset of weakness on one side, loss of language, severe headaches, or loss of consciousness.
I heard her falling on the floor for no reason. So I rushed to her and I realized that something was very wrong. I could see half her face frozen. I could see half her body frozen. She could not talk. She could not get up. So I immediately realized the emergency of the situation, and I immediately called an ambulance.
You were assessed by the emergency doctors and then a neurologist, and you got a CAT scan done, a CT scan of your head immediately, and we immediately transferred you to the City Hospital in DHCC, where we have a comprehensive stroke center where we would be able to get into the vessel and get the clot out. This effort we have established in our Mediclinic platform with several hospitals that have emergency rooms, can accept these patients, can call into the hub center at City Hospital and get further information as to how to deal with these patients. It is our belief that it is a team effort, actually including the patient and the relatives, for rapid recognition of patients and make sure that the patients and relatives understand immediately that it is a stroke, a time-sensitive situation. We only have a few hours, 3 hours to give the IV TPA and about 6 hours to complete a thrombectomy procedure. The case of a 53-year-old female, the stroke was very severe and there was a very big blood clot sitting in the artery in her brain. A more sophisticated CT scan with looking at the arteries of the brain was performed.
In the brain scan we can see a large thrombus in the left sylvian artery, and also this thrombus is confirmed in angio that study the vessel. A very special large catheter inside the thrombus is a thromboaspiration catheter. And after we pull back the catheter, this is the first after the first passage, and this is after the second passage. We restored completely the flow inside the brain of the patient. You can see also this angio, final angio, completely restore the flow in the brain, and this is the most important picture because this is the scanner after 24 hours. Major part of the brain parenchyma is safe.
I still don't have control over it, but I have a lot more than what I did.
The time from stroke onset to complete recanalization in this patient was 3 hours and 25 minutes, which is a very, very good time. And only 3 days after her stroke, her severe stroke, she was able to be discharged.
It is important to seek medical advice immediately as soon as the stroke is suspected. Don't wait. Remember, as we used to say, time is brain.